for people who have diagnosis of autism or intellectual disabilities or developmental disabilities, many times their very valid primary care concerns are dismissed because they have the diagnosis of autism or intellectual disability, etc.
Hello, and welcome to Disruptors at Work, an integrated care podcast. We're excited to discuss neurodiversity, affirming care in integrated care settings.
Hello, and welcome to Disruptors at Work, an integrated care podcast. I'm Dr. Pauline Pablo, special host for today's episode, and I'm joined by Dr. Corey Canaday, Assistant Clinical Director at Elevate Behavior Services, Dr. Patricia Motovich, Clinical Director at The Perfect Child, and Dr. Valeria Parejo, Behavior Analysis Consultant. We're excited to discuss neurodiversity affirming care in integrated care settings. Let's get started. So my first question is, how would you define neurodiversity, neurodivergent, and neuroaffirming care?
So I think, when we hear neurodiversity, we have to understand that everybody's brain functions a little bit different in the way that they process information and the way that they react to stimuli in the environment. So neurodiversity itself is the idea that is the concept that everyone's brain has this, kind of minute differences in the reactions and things that they process. And then along with that, of course, neurodivergent would be anyone that falls into the category of this different processing. And then neuroaffirming care is just a healthcare approach where you are standing more with the patient rather than trying to change the patient. You're acknowledging neurodivergence and setting them up for success in a way that's good for them.
Yeah, anyone would like to add to that?
To follow up on that,
Go ahead.
sorry if I cut you off. To follow up on that, like Corey mentioned, we all different, and if we were the same, the world would be boring. So people who display certain characteristics in the sense how they process information, how they function, they can be categorized with people with ASD or ADHD. Mm-hmm. And the bottom line is that we all have certain ways that we process information, and we can categorize ourselves as a little bit of having certain characteristics or another. But if it comes to people with severe delays or issues with processing information, and their brain functions in a little bit different way than the rest of the population, this is where we have to just adjust to those people. And I see it like as everything else, in the sense of people who are left-handed have to adjust to right-handed world. However, we provide some assistance and some adjustment to those people. So this is how I see it, and this is how I approach it.
And I was going to add that I think it's moving, neuroaffirming care is a movement away from pathologizing differences and really embracing people and ensuring that we are working towards quality of life and well-being instead of seeing differences as a problem.
Totally agreed. And I think with what Patricia had mentioned too, with being left-handed versus right-handed, back in the day, people who were left-handed were being forced to be right-handed. We didn't have the accommodations, no left-handed scissors, right? But it's similar now. It's not that the rate of left-handedness is increasing, it's just the acceptance of left-handedness is increasing. And that is the same with neurodivergent individuals. It's not that that's necessarily increasing, it's just the awareness of it is increasing. So let's move on to our next question. What is the current state of neurodiversity in the behavioral health system?
So I think the increased number of diagnoses with ASD and ADHD specifically is because of the better understanding of what that really is. And for example, in past years, we thought that more males are diagnosed with ASD versus females, but now we're learning about camouflaging and masking. So that opens up a little bit the view of the practitioners and how to really approach the problem and how what to look for really, because like we all know, in females, teenagers will start displaying certain characteristics, and this is like a tip of the iceberg, that the issue was elsewhere. So I think that moving forward, and same with ADHD, in my program, in my dissertation, actually I was like researching a little bit of ADHD and ASD, and I have a full-blown ADHD, and I had it since I was a little kid. The problem was when I grew up in Poland, nobody knew what that is, and because I was a girl, so it was not really seen as a person with that deficit, if that makes sense. So as I am the practitioner right now, in the with the knowledge that I have about this, I always had it, and just it happened that I was able to cope with what I had, and a lot of people are not as fortunate, and they need a little bit help with this. So I think, see, even like right now, I'm like diverting from the subject, but to go back to what the question was, it's not like it's more of them are diagnosed with those. I don't even like to call it disability, because not it's not really a disability. It's like being different. It's just the awareness of what it is and what to look for.
Yeah, the question made me think of a couple things specifically. One is that I think the acceptance and acknowledgement of these differences that we're seeing kind of across the board have spurred voices to be heard. I think there's more advocacy happening by those that show these differences, regardless of what it may be. And so I think for the first time in the healthcare system and otherwise, that these voices are being heard and not just pushed to the side, or being muffled the way that they have been in the past. And I think that leads to my next point, which is the research behind a lot of this is just now starting. Right, we're kind of behind the times when it comes to research for um, certain disorders or certain mental health kind of things going on out there, specifically with autism. That's there's still not an understanding of a cause or a reason and things like that, and research is very kind of dim when it comes to a lot of these differences that we're discussing today. But hopefully this advocacy and this awareness really pushes for that, just so that we have a better understanding
I agree
altogether.
with what Corey just said, that there has been significant improvement in the level of awareness and advocacy. I still think that in the behavioral health fields, there's still a lot of work to do to actually implement changes to truly accommodate and allow people to have access to quality healthcare services. I think all of us here in this panel are coming from a very specific, skewed perspective, because we're coming from behavior analysis, and we have been trained, and um, we have been specifically trained and have received a lot of supervision on the providing services to a neurodiverse population. But I don't think that this is true for all areas of healthcare. In many areas of healthcare, in medicine, in nursing, etc., those practitioners perhaps are not getting coursework, for instance, is specific to that, unless they pursue it themselves. It's not part of the general curricula of medical school or nursing school. So I think we need to push towards that, to making sure that being if we are going to be in the healthcare service delivery field, all of us should be well trained to ensure that we are willing and able to attend to the needs of all the population.
Absolutely agree. I think we are seeing that trend towards progress because we are in this field, right? But then if we go look into the medical care settings, hospital settings, there's definitely still that lack of understanding. And yeah, I do agree there
Yes,
needs to be that.
to follow up on that, like actually, I see the issue even with the field itself,
Mm.
where I recently, as a clinical director, I had a rejection of services, ABA services by insurance because a girl was diagnosed at the age of 19 and insurance was claiming that the symptoms were not visible before she was like 2 or 3 years old, which does not really follow the diagnostic criteria. And this is the issue with keeping ourselves updated in the field and about the ASD or ADHD itself. Okay, so I see the issue like before we like look at other providers, we have to look at ourselves and make sure that people who serve this population, they are really well educated and updated on what's going on and what to really look for. But healthcare, especially here in New York, I can tell you this much that it's very very little that it's done to accommodate this population in providing even services, healthcare services. So we are progressing for sure, but I think that our voices need to be heard, and we should like really push forward to advocate for this population because they can't advocate for themselves.
Absolutely agree. And that actually transitions to our next question really well. What are some of the biggest challenges that you've seen or experienced given the lack of neuroaffirming care in traditional healthcare settings?
I think, um, in my experience, Western medicine tends to be, I present myself at a primary care facility with these symptoms. The doctor diagnoses you, looks in a little book, decides that they're going to put you on a medicine, and they send you on your way. You come and follow up how that medicine do. Um, I think one of the biggest challenges is going to be the change itself, from a very traditional Western medicine view to a more contemporary ideology of neurodiversity and things that come along with it. But that change is going to be hard, and it's going to take, education, like Dr. Motlowitz said, and I think that starts from uh, those educational institutions that are doing that training. From med schools to anybody else. Whether it's continuing education or it's presentations or different I've lost my word, but any of those people that are in charge of training others or educating others really need to be the ones of the focus of change.
Okay, so to follow up on what Corey just mentioned, and I'm going to also go back a little bit to BCBAs. We are all BCBAs who provides ABA services to people with ASD. We are not really educated well enough in the field where in the programs we are not really taught about comorbidities that are along with ASD. And sometimes we see in the field people treating certain behaviors that are really affected by something else. So I think that knowing even like by ABA practitioner, and being aware of other medical issues that the individual might have, and really referring to the specialist medical provider would be the really way to go right now, because this is the missing link, I think. Medical providers are not informed on what ASD really is, and what to do with it, and they're not aware of comorbidities as well as BCBAs, and this is like a vicious cycle. There's a lot of going on, and nobody really addresses that, because again, individual with ASD is not able to advocate for themselves or even express the symptoms or issues that they may experience.
I was going to add also that being a neurodivergent individual affects the quality of care that you have even in primary care. I started my career working with adults in residential group homes, and it was really sometimes an uphill battle for us as staff to advocate for them when we would take them to their primary care physician, where for people who have a diagnosis of autism or intellectual disabilities or developmental disabilities, many times they're very valid primary care concerns are dismissed because they have the diagnosis of autism or intellectual disability, etc. So, um, not having neuroaffirmative practices definitely affects all aspects of health for people who are neurodivergent. So, uh, pushing for what Dr. Patricia and Corey have said of like improving training for healthcare providers is definitely a first step that needs to happen immediately.
I could not agree more. I think to add on to that, diagnostic overshadowing, right? That's something we talk about all the time. And this recently happened with an individual I was working with, a child with um, epileptic seizures. And we know how seizures look like. It could look plenty of different ways. Sometimes they're just absent and you can't even tell. It's very subtle. There are times when it's dropping to the floor, or um, just having, that the physical reaction. But I've seen too many doctors, primary care providers, just dismiss it as, oh, that child has autism. Those are just behaviors. And that's extremely frustrating, because it's dangerous for a child to keep having epileptic seizures without the treatment. And for it to just be dismissed like that, it shows that there is a lack in education as far as what are those co-occurring conditions, and it's fairly common. Another thing is that they regress in skill, and that just gets brushed off as, oh, that's autism. They're just having the typical regression, but that could be caused by those epileptic seizures. So yeah, we definitely have a lot of challenges currently as far as neuroaffirming care.
Dr. Pablo, I was going to say as well, going on what you said, I think this is even more significant in rural areas. At least in larger cities and things, they have the resources out there to educate the population that's within their area. And then you get into the rural populations, and there aren't specialty services a lot of times in the rural areas. And so these primary care providers are going simply on what they've known for 15 plus years based on their education, but they also don't have the resources that they can pull in the way that you can in a more populated area.
That's such a great point, and I actually think that segues to our next question, which is, how does integrated care models of practices help address these challenges that are experienced by neurodivergent individuals? And how does this impact patient outcomes?
Okay, so maybe I'll start. You would think that New York is a huge metropolis, and that care would be provided in New York, and it would be more accessible versus rural areas, which is completely not true. So in dense populations in the cities like New York, it's too many people that are like receiving that care. So medical providers are not really having time to focus on those individuals and provide appropriate care. So integrated care is a great idea and would be great if it was in practice, but I think it's still very, very new idea here in New York. I'm speaking about the area where I'm located, and it's just too populated. And again, we're going backwards to the education and really resources provided to develop the care and some protocols and provide those individuals with at least minimum accommodation so they can access the care. So I personally, when I work with individuals with ASD, I prepare emergency plan for the parents, what to do and how to proceed when they go to ER, for example, because ER can be scary to any kid. Imagine a child with ASD with all severe behavior, so they completely not prepare for that. So as a practitioners, like I think we can make a small change, but a bigger change is definitely needed in the field.
I agree. I agree. I do think that when and if care begins to be truly integrated, it's really going to make a difference for neurodivergent individuals simply because you have a behavior service provider, whatever they're going to call it at the time, who is trained in these things, who can either assist with the doctor or the provider in discussing, okay, these are ways that we can really help this patient's appointment based on their neurodiversity, or simply sitting in the appointment and trying to talk through processes better with the patient, since they have a better understanding of how these neurodivergence minds might think, or also might have an understanding of where to go next that the primary provider might not have.
I think as behavior analysts, since all of us are in this category, besides being doctors of behavioral health, we can play a huge role in this. For me, going to a DBH program was going for full circle because, as I mentioned, I started my career as a behavior analyst in a residential provider, right, and working in group homes. And so it was expected of us to be the liaison, the behavioral liaison with the primary care with the other providers. I just didn't realize at the time that it was like a proto integrated care setting. And so I think that because we have this background and many of us have more expertise with a neurodivergent population, we can definitely help the other providers jump into our boat and provide those services through the integrated care approach lens.
I absolutely agree with that. And as DBHs, we have an understanding of that biopsychosocial approach. And I think that's just such a great formula to provide that whole person care. And when we are in those settings, teaching medical providers and other paraprofessionals how to view neurodivergent individuals with that biopsychosocial approach, we're able to target just everything that affects their healthcare. So I do agree with that. So, what are some practical steps that healthcare professionals can take to integrate neuroaffirming care into their practice?
Educate themselves. Educate themselves because this is not enough. Like Corey mentioned, especially those rural areas, people know what they learned years ago in medical school and they don't know anything else. So I think that the push for really progressing and educating in many areas, we're talking about neurodiversity here, So educating all the professionals, providing some embedded, mandatory, like even webinars or classes would be helpful. But I think that the situation really forces us to go that direction, because we have maybe not more individuals with these diagnoses being patients like recently, but we are more aware of them, and also the that awareness is causing that we look at those people like in a little bit different way, and we start to understand what really needs to be addressed. So education, education, education. Like I couldn't stress that more. And again, first I look in my own field. A lot of BCBAs need to be educated, and the knowledge through CUs or going back to school should be really keep updated on a like yearly or even a monthly basis, because science changes so much that more details and more aspects that we weren't aware in the past are coming to the light right now.
Yeah, I think there are some practical approaches that can be taken right now. I think the first one being, if we're not looking to integrate care, then you can adapt your diagnostics, and you can adapt your procedures and approaches to meet the needs of these neurodivergent individuals, whether that be, as simply as doing something like flexible appointment times, taking more time with patients, using alternative diagnostic tools or approaches. But even past this, I think it's important for us, but also all providers, that we need to continue to advocate for policy change and systematic change, across legislatively, educationally. And then lastly, I think one of the things that is really valuable is feedback. So I think these providers, I don't know how they get feedback, but I think that would be really important moving forward in adapting to the neurodivergence that is clearly around us everywhere.
I would like to add that one very important step that I think all of us in the healthcare field need to take is truly collaborate with the people receiving the services. So, healthcare providers should be hiring neurodivergent consultants to ensure that the practices that they are following, the accommodations they're providing, truly are making a dent in those barriers that we all are trying to fight against. I think that, of course, continue to educate ourselves from the academia and research, of course, is very important, but it is extremely important for us to listen to the people that are actually receiving the services. And that is an education as well. So hiring consultants that can tell us from their lived experience what it is like to receive healthcare services in a neuroaffirmative way is definitely going to make the difference.
Absolutely agree. So, our next and final question actually is, what future innovations do you see in the integration of neuroaffirming practices within healthcare, and how could they impact the industry?
I think I think we're going to have to move that way. We're going to have to, and I think those that are hesitant to are just going to be behind the game. Research is going to continue to come out, and new practices are going to be coming out, and I think we just have to stay up on our game, basically. And as far as how it could impact the industry, I think significantly. One, you might have those that are neurodivergent seeking actual medical care that they may not have sought before because there weren't neuroaffirming practices in place. And then on top of that, I think just as a whole, everyone's going to be a little more willing to, turn their phone down a little bit for somebody that has some sensory issues, or um, just being aware of others in their space, I think is going to be uh, invaluable in the end.
Okay, I think that just the way we adapted our healthcare to provide access to healthcare to people with visual or auditory impairments or physical impairments is going to be just the way the same we're going to provide those accommodations to people uh, with ADHD or ASD. So we adapted, and like when we look back, like even 20 years ago, not always that those accommodations were available for those people with those impairments, and now everywhere we go, we have opportunity to access. We see the accessible areas. So I think that's the same approach, and the with the same approach, we're going to achieve that, and we're going to provide this. These accommodations to those this population same way. It's just a matter of time, but we have to keep pushing for it.
I think one innovation that I see that could potentially speed up the process of acceptance of neuroaffirmative practices is the switch to value based care, just because it's going to require measurement of outcomes for those patients. And so I believe that the healthcare providers that would have made that transition to educate themselves, to change their practices, etc., will obtain those better outcomes for their patients. And so in that sense, I think that value-based care could potentialize this transition, make it much faster, and I'm hoping for that.
I also want to add um, kind of moving the neurodiversity or neuroaffirming care acceptance and extending it to healthcare providers as well. Because many of us in leadership roles and supervisory roles forget that the staff that are under us, or our supervisees or paraprofessionals, nurses, doctors, that many of those people in these positions are neurodiverse as well, or I mean are neurodivergent as well. So there are certain things too that we could do in just when we have staff meetings, just certain accommodations, allowing, certain extending time for certain employees and things like that. I think if it's normalized that we are neuro affirming in all aspects, whether it's in the business side of things or healthcare side, education side, I think once that's normalized, it'll definitely push this movement, much further. Would anyone like to add any final thoughts?
Yeah, actually, to follow up on what you just said, many adult people with, especially with ASD, once they receive their diagnosis, they just, now I know nothing wrong with me. Now I know what I have. So like I said, I lived with ADHD all my life, and I just was able to turn it around and use it towards my advantage. So if we're going to start look at those disabilities from that perspective, it's not really a disability. It's just a different way of perceiving everything, and we have challenges in certain areas, but we can be very very successful in a other, like professional even life. So once we're going to remove that stigma, I would say, and call it a disability, and just embrace it, I think that would make a huge impact, because when we're going to look around, we all have something. We all have something, and we're fortunate to be able to cope with that.
Agreed. And that's why I think looking at the support needs rather than pathologizing and boxing someone in with their diagnosis.
Exactly.
Okay, you have this diagnosis, you're boxed in. These are the check boxes, and these are the things that you need. But that's not how it is. We all have different support needs. Yeah, and thank you for sharing, Patricia, your lived experience there.
Sure.
Any other final thoughts? No? Okay. Well, I want to say a big thank you to our incredible guests for sharing their insights and expertise today.
If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.